When I see patients in my office with heel pain, most assume that they have a heel spur. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. While that may or may not be true, the heel spur rarely is the cause of pain. Your pain is most likely caused by plantar fasciitis. In today's video, I'm going to discuss how to tell the difference between pain from a heel spur and plantar fasciitis. I'll also share some effective home remedies to get you feeling better. But before I do, let others know about these videos. Please like, comment, hit the subscribe button, and share on social media. This will help others find this information. I also wrote a book all about heel pain. I'm happy to send it to you for free at www.heelpainbook.com. When I show my patients their x-ray when they come in for heel pain, they may see a big heel spur on the bottom of the heel bone. While it looks like it hurts, would you believe that a heel spur is not usually the cause of your heel pain? In fact, that's the reason people don't come to get their heel pain checked when they have pain. They assume that they have a heel spur and it needs to be removed. They've already decided that they need surgery and don't want it. Here's the good news. Surgery is rarely needed to cure your heel pain, less than 5% of the time. So if the spur is not causing your pain, what is? It's usually plantar fasciitis. I'm sure you've heard of it. It's extraordinarily common. Plantar fasciitis and a heel spur go hand in hand. If you pull back your big toe, you'll see a band of tissue become prominent on the bottom of your foot. That's the medial band of the plantar fascia, and it attaches to your heel bone. If you have plantar fasciitis, doing this maneuver may reproduce the pain you typically feel. And that's what happens with every step you take. The thick, elastic, fibrous plantar fascia pulls on your heel. Each time it happens, it causes microtrauma that your body tries to heal. That's what inflammation is. Your body sends up a flare that something's wrong and to send resources to heal it. The problem is that you keep walking and your body can't catch up with repairing the damage. That's why the pain seemingly never goes away. But if you can reduce the inflammation, the pain will go away. Yes, you can be pain-free even with a heel spur still there. The first thing you can do to reduce inflammation is to ice your heel. You can do this by applying an ice pack to your heel for 15 or 20 minutes. Even better, freeze a plastic water bottle and roll it under your foot from the heel to your toes. Try to ice at least twice a day. You're probably feeling the most pain when you first step out of bed in the morning. You can help this by stretching your foot with a towel before you get out of bed. You should also roll a tennis ball beneath your foot for 30 seconds. That will help ease the pain with those first steps in the morning. If you're able to take over-the-counter anti-inflammatory medication, it will help to reduce the inflammation. You can also use topical anti-inflammatory medication available over the counter. Many of my patients have relief with CBD creams too. Doing this should improve your pain approximately 50% of the time. If your pain goes away completely, don't stop stretching. Continuing the stretches is a vital way to keep the pain away. If the pain continues, then focus on your shoes. Make sure you're wearing a well-fitting supportive shoe. I like running shoes since they typically provide the most support. You should also consider an off-the-shelf insole, and remember you want insoles that support your foot so they can't be floppy. Get a good insole from a running shoe store. Some brands include Ready Thotics, Superfeet, Power Steps, and Spenco. You should also try a stretching splint or a night splint. These will keep your feet in a stretched position at night and really help to prevent the pain you feel when you step out of bed in the morning. If you can't wear the splint all night, then wear it for an hour before you go to bed and then 15 minutes when you wake up and before you step out of bed. Additional stretches would be helpful. In addition to stretching with a tennis ball and ice bottle, stretch your calf and hamstrings. Everything is connected, so loosening these muscles will also have a good effect on your feet. Doing this will help approximately 75% of the time. If you still have pain, it's time to come into the office for treatment. There we can consider treatments such as cortisone injection to drop anti-inflammatory medication right where the inflammation is. We can consider shockwave therapy and non-invasive treatment to enable the body to resolve the inflammation. Custom foot orthotics are also very helpful to treat plantar fasciitis. It's next level customized support that you move from shoe to shoe. This allows you to have the customized support to allow your feet to function optimally. The remaining 5% or less of people still having pain may need surgery to address the problem. Your odds of not having surgery are very much in your favor. Let's go back to that heel spur. How do you know if the heel spur is causing your pain? The heel spur causes pain when your fat pad in your heel wears away. Unlike plantar fasciitis, where you feel pain when you first step out of bed, you typically have no pain with those first steps with the heel spur. You can expect increased pain as the day goes on and you're on your feet. Don't be discouraged. You can add artificial fat beneath your heel by using a gel heel cup. That will cushion the heel spur and resolve your pain. Thanks for taking the time to watch this video. Please take a moment to like, comment, and share on social media. Be sure to hit subscribe so you won't miss another video. Don't forget to pick up our free book all about heel pain. You can request it at www.heelpainbook.com. If you've been suffering with heel pain and home remedies hasn't fully cured it, come in for a visit and let's see if we can get you relief. That link is also in the description. Thanks so much for watching and have a great day.